how many of you have ever fallen off your bike or down a flight of stairs when you were younger? Most of the time, you'd either skin your knee, get a bruise, or at worst, break a bone, and think little of it, correct? When you break a bone, the bone will heal itself. But what happens if your muscles, tendons, and ligaments turn into bone as well? What if you have formed a second skeleton on top of the one you already have? Fibrodysplasia ossificans progressiva, which is a mouthful to say, is also known as FOP disease. It is a rare disease that can turn your muscle and soft tissue into bone whenever there is trauma to the area. Today I will explain what it is, how one may live with this tragic disease, and the possible future cures or treatments for it. One may ask, what exactly is Fibrodysplasia ossificans progressiva, or FOP? FOP is a rare genetic mutation in which causes excess bone to grow in places where muscle once was. Affecting 1 in 2 million people, there are stories going as far back as the 1800s of people being stone men. However, the term FOP was not introduced until the late 1970s. Because the disease is so rare, the symptoms are often misdiagnosed as cancer or fibrosis. This leads doctors to order biopsies, which can actually cause the growth of extra bone. The term FOP literally means soft tissue or muscle turning into bone. As stated before, this mutation only affects 1 in 2 million people. There are currently 700 confirmed cases in the world and 185 in the United States. Justin Hankey, an 11-year-old boy, has this disease and lives right here in Delaware. How did his family find out he had this disease? Since birth, Justin has had deformed toes and was missing a few minor finger joints. However, it was not until Justin was 6.5 years old that he was clinically diagnosed with FOP. Justin is fully aware of his condition and knows that he may wake up one day and not be able to move his arm because all it will be is bone. And it's really upsetting to me and my family because he swims on my swim team with his brother and sister, and his family contributes so much to our swim team, and it's really sad. Some people may think to lock their kid up in some room where they would not be able to hurt themselves, but not Justin. He has a swing set in his backyard, he's a Boy Scout, and he's on a competitive swim team. He also rides his bike around with his brother and sister. He is a perfectly functioning 11-year-old boy. Things aren't the easiest for him, though. Whenever Justin has to go to the dentist, he can't move his mouth for a long period of time, or he can't keep it open because his jaw will lock up. Unfortunately, the bone forming begins around the age of 10, and most people with this disease live to be about 28 years old. And how you die is where your lungs can't expand because all there is are sheets of bone over them. So one may think that removing the extra bone surgically would be the best option, but by doing that, any attempt to remove the extra bone only leads to more extra bone formation. However, things have started to look up for people living with FOP. As of right now, no cures have been found for people with this disease, and up until recently, there have been no treatments for it either. As of April 3rd, 2011, a potential treatment for FOP has been found. An animal treatment study done by development biologists show that a drug interrupts a signaling protein pathway that can prevent heterotopic ossification, or in English, an abnormal buildup in bone tissue. There have also been studies where baby teeth play a role in finding a cure, and as it turns out, baby teeth that fall out have a few small shreds of living gum tissue still attached for the first few days. FOP researchers got the idea of trying to use those small gum bits from the teeth and checking to see if those cells would show signs of FOP. And it turns out that the flesh of gums, as found in baby teeth, can be effectively used for FOP research purposes. The amounts of gum are small, but are enough for researchers to develop a new lines of cells for study purposes. Dr. Kaplan from the University of Pennsylvania is one of the most prominent researchers for FOP. If one of these treatments works, it's going to be a huge relief for people with Fibrodysplasia ossificans progressiva. So now that you know a little bit about FOP, the history, living with it, and the possible treatments for it, I hope you realize how lucky you are to be able to get injured and think little of it. For someone with FOP, a fall is not just a fall, and the typical bumps and bruises of everyday life are a major threat to the mobility and independence. If a person with FOP bumps his elbow or knee, bone could begin to grow there and lock up their arm or leg. For more information, or if you would like to contribute to helping find a cure, please go to www.ifopa.org.